everyone, thanks for tuning in to EasyLiving.com. You know, in a previous webisode, we did a story about snoring and how it can lead to sleep apnea. And it got me thinking, well maybe, just maybe, I have sleep apnea because I'm experiencing the symptoms: shortness of breath, snoring, and when I wake up, I feel really tired. And you know what? It got me thinking, maybe I should investigate and do some research on this subject matter to find out what sleep apnea is. So let's take this journey together and hit the internet. So here we are. We're going to head to the computer lounge and do some research. Well, this is interesting. Sleep apnea, if undetected, could lead to a heart attack, heart failure, stroke, and even type 2 diabetes. So here's a piece of information that I think it's important for you to know. Did you know that 4% of the world's population is affected by sleep apnea? And we all know that car accidents are the leading causes of death worldwide, of which 15 to 20% are sleep related. It's shocking. So I've had a chance to go through the research on the web. We've taken a look at WebMD and some slideshows that talks about and describes what sleep apnea is all about. But I found this really nice video on the web that I think it's important to share with you. Have a look.
When most people are asleep, air flows freely through the upper airways into the lungs, giving a stable level of oxygen in the bloodstream. In individuals with OSA, the tongue and soft tissue in the airway relax during sleep. As the tongue and tissue partially obstruct the upper airway, it causes loud snoring. When the tongue and tissue totally obstruct the airway, it causes an apnea and breathing stops. The chest continues to move as the person tries to breathe, but the blockage prevents fresh air from reaching the lungs. The oxygen content in the blood goes down. An apnea may last anywhere from 10 to 60 seconds before the brain recognizes that there is a problem. The brain briefly arouses the body from sleep, just enough to open the airway. The person with OSA can be observed snorting, gasping, or choking for breath as the airway opens and air flows back into the lungs.
Wow, the information is overwhelming, and it's safe to say that I do have sleep apnea. But I'm not going to just rely on the data that's available on the web. I'm going to take the right step, and that's go see a doctor, a specialist on this subject matter. So come along with me on this journey as we investigate sleep apnea together. Thanks for tuning in to EasyLiving.com, where you can find anything and everything lifestyle. Hi everyone, thanks for tuning into EasyLiving.com. So, today I woke up and unlike every other morning, my wife was angry. She was pretty upset. And I asked her why, and she said, look, throughout the night you were snoring and I couldn't get enough sleep. Now we realized that snoring can be really agitating or upsetting to the person that's sleeping next to you. So, like me, you snore. Did you know that there are certain conditions that actually contribute to it, such as being overweight, smoking, drinking alcohol, and having nasal and sinus problems? Now the question is, where does the sound of snoring come from? Well, to put it in simple terms, it's the constriction of air into your lungs. Your tongue falls back, thus narrowing the inflow of oxygen. But the focus of this webisode is more than just the irritating sound. There are serious health consequences behind snoring, and that's what we intend to explore. Did you know that while snoring, the brain won't receive sufficient amount of oxygen? And as a result, it may cause high blood pressure, heart attacks, and strokes. Research has shown that snoring may even lead to type 2 diabetes. So how do you take action? Well, there's 2 steps. First, try certain remedies at home. For example, tilting your head 4 inches, put an extra pillow under your head. Make sure the air in your bedroom is moist. You can buy these mini humidifiers add some drops of eucalyptus to it, and you'll have a better flow of oxygen in the room. And the third are nasal strips. They open up the airflow and you'll get a good night's sleep. Now, these remedies may not work for everyone. If your snoring problem is severe, you will have to check in with a doctor. It may actually be sleep apnea. And this is a topic we're going to carry on and have a conversation about over the next 12 webisodes. Sleep apnea is serious, and there are medical solutions and devices that can help you overcome it. Thanks for watching EasyLiving.com. I'll talk to you next time. Hi everyone, welcome back to EasyLiving.com and another episode on Easy Health. And this is basically a continuation of my journey to discover whether or not I've got sleep apnea. Well, over the current webisodes that you've seen, I have sleep apnea, and Dr. Quwatli from the American Hospital of Dubai has said so after doing the sleep test. So I'm here with Anas, and he's going to explain what kind of device I should be looking at and what are the elements that goes into setting up such a device on me.
First, I would like to show you our latest technology from Philips Respironics. This device is called Rimstar Auto Aflex, which is the latest technology, which we call it the 60 series. Now, this device mainly it contains the main unit, then we have the humidifier, as well we have the tube and the face mask.
So Anas, the question is, look, I've been on the internet and I've tried to search for a CPAP device. I think that's what it's called.
Yeah.
And there's no concrete information, especially about local content. So if I'm looking to get a device, I really don't know where to go.
Mainly as a CPAP, the CPAP term, it comes to continuous positive airway pressure, which it means that we are pushing air inside the airway in order to open the airway of the patient. Because normally the CPAP patients, they having like chronic diseases while their airway is partially or totally closed. So what we are doing, we are just pushing an air in order to open the airway.
Okay, so how does a patient like myself determine what is the right solution for me?
Okay, so mainly before the patient will come to know that he needs a CPAP device, he should do something, we call it a sleep study.
Yeah.
Sleep study, mainly the patients, he will do it in the hospital, so the doctor can know which type of severity, which type of sleep apnea the patient is, if he's mild patient or moderate patient or severe patient. Then after that, the doctor will do something, we call it titration test. Titration test is to know what's the best pressure to the patient, and based on that the doctor will recommend the patient to go to the company and choose which device is the best for him and what's the best level of pressure.
I have been through the sleep apnea test, and you can click right here, you can see the test that I went through, and Dr. Quwatli said that I have mild sleep apnea. So how many levels are there, and when we say mild, then do you determine which device or which face piece or mask would best suit me?
Now, as a sleep apnea type, this will consider to us which mainly a level of pressure we should use, not as a face mask.
Got it.
Because mainly as a masks, it's mainly for the patient comfortability. So whatever it's more comfortable for you, then you can take it and buy it.
So that's a good point. What it really determines if you have mild, medium, or severe, you will allocate a different kind of device for these patients.
Exactly.
Because that again determines the different kinds of that air push into the lungs.
Now, as a masks, we have different type of masks. We have mainly like 3 types. We have the face mask, and we have the nasal mask, and we have the nasal pillow mask. Mainly we can differentiate it based on the patient comfortability. Usually we ask the patient if he's breathing from his mouth during sleeping. So if the patient is opening his mouth during sleeping, then we will recommend him the face mask. Why? Because the face mask is covering nose and mouth. But in case if the patient will be using the nasal mask covering only the nose, and he's opening his mouth during sleeping, then the air will come from the nose and some part will go out from the mouth. Then we'll be having a more leak from the machine, which will reduce the benefit which we needed from this device.
That's a good point. So depending on how you breathe during the night, you would probably require either a nose mask or a full mask, which basically covers your
Exactly.
nose and mouth. But how do we know that? I mean, who's going to tell us?
Yeah, mainly your partner.
Right, okay.
Mainly.
So your significant other will basically say, hey, look, you need the full mask. In my case, I think I'm going to need the full mask.
Yeah, I think so.
Okay, so let us see how this device works.